Fowl cholera. So we are picking Fowl cholera, which you have a good case study to share with audience today. We know that Fowl cholera is a bacterial infection, a bacterium classified as Pasteurella multocida, which you can identify in the laboratory when stained on the blood smear as a bipolar rod-like shaped bacterium. And this bacteria, of course, has specific periods at which it wants to affect your breeder or your layer. I will be emphasizing effects on breeder and layer, and the period of time that this bacterium can want to surface in your farm. Usually, it is when your birds are approaching the peak of production, around 26 to 27, 28 weeks of age. You see it affecting them at that period. And they have predilection site that you must be observant to see. Before that, the route of infection will be through the nostrils or through water contamination or through fecal contamination. So if that is the route, then it must be that the hygiene must be very, very standard in the farm to prevent this, because what could transfer this infection could be vermins, it could be birds like canary birds, it could be lizards that can carry them into farm. But let's start at the first infection you might see in the farm between 26 and 28 weeks, and the clinical symptoms that you are likely to see. We will give you a picture to see the typical symptoms you will see. And I have the picture. That is the typical picture of a bird that is affected with Fowl cholera. You see the wattle, and in some cases the comb and the facial muscles can be swollen. You can see some exudate from the nostrils. You can see cyanosis, which is not shown here. Cyanosis of the surface muscle, that is the bluish coloration of the skin.
Yes,
And the birds can be coughing. You look at the glands that are swollen, and there could be lameness. These are typical symptoms that you will see. That you can start, though there are differential diagnoses, but these are often what you see in case of Fowl cholera as a physical appearances of your birds when they are about the age of 26, 27, 28, and you are expecting to have your highest peak of production. The postmortem you can look at when you open your birds, you can find some lesions. We are going to pick specific organs that you should look at. Look at the liver. Surely there will be serious evidences of liver fatty degeneration. The liver will look like if it's cooked, or you can have some oil globules that are settling on the surface of the lobes of the liver. Look at the ovaries. You see follicles that are being degenerated. These follicles are to be in the roundish form or in various stages of development. But when they are attacked by Fowl cholera, you see the follicles as follicles as flabby, but with a long stalk holding them. This is a pathognomonic lesion for Fowl cholera. This evidence is in the ovary. Then you see the petrification on the myocardium of the heart. And of course, you see also the yolk peritonitis. These are good symptoms to want you to start to think that you have a case of Fowl cholera at hand. But that notwithstanding, I think we need to go further to approach the laboratory and to have a final diagnosis. But that was not the case some years back. We stop at this diagnosis here and we proceed to treatment. But today we're lucky that we have laboratories that are surrounding us. We don't have to limit ourselves to this physical diagnosis. We have to go further to laboratory that confirm that send this blood smear that show that the organism is bipolar Clostridium organism. And then you go further to do a sensitivity test that gives us the best the drug. But in practical purposes and in many places, You may not have an opportunity to go to this stage or to extend to this stage. So what we do is that we'll start treatment. And, and this treatment, in the case study I'm going to report to you, you'll see what we did, and then and the approach we took in some Fowl Cholera infection in breeders in Nigeria. Next slide. This is the documentation of some of our case studies in the field here in Nigeria. I hope you can see them. I hope you can see them. You see the whole period, duration of the infection took over about 5 weeks. And one thing with Fowl Cholera is that it's not easily treatable. Fowl Cholera can go through the lifespan of a frog, but occurs in circles. After you treat, it can recur. After you treat, it can recur. But you will see in the course of this treatment, in the course of this study, how you can actually identify the circle of infection of Fowl Cholera. But let's look at this case study. You see that our source of drug here was enrofloxacin, and which we used for the first 2 weeks without significant results. The first week we had about 0.78 daily mortality. Then we switched to enrofloxacin plus vitamins, and we're having 0.8% on daily basis. The percentage production was 44.7, and it went to 44.4%. This is not a good, impressive result. And so we decided, led by my initiation, I said, and I talked to the nutritionist, that after postmortem, we saw the lesion of the liver, we saw the magnitude of fatty degeneration extent of the liver, and I spoke with the nutritionist and I said, it should allow us to look into the dietary management and how we can interfere into the dietary management. He agreed, and we both discussed, and we agreed that we need to reduce the energy level of the diet. The diet at that time was on energy level of about 3,000 kilocalories, because they're breeders. And so we scaled down the energy by about 5% the first week or the third week, and we had a significant improvement in mortality. The mortality dropped by about 50%, as you can see in this table. With the dietary adjustment, mortality went down to 0.4% on the daily basis. And thereafter, we decided to start to scale down the diet, and we're having progressive improvement in the mortality. As you can see there in the slide, can they see the slide, please? Let's go back and let them see the slide. You can see that in the slide, on the third week, we had 0.4, and then the fourth week is 0.27, and the fifth week is 0.15. All dietary adjustment, no drug. So it's pure dietary adjustment. But on the scale of percentage production, there was a slight improvement in percentage production, but it was not significant enough. I think on the fourth, between fourth to fifth week, it should be appropriate, it should have been appropriate for the farmer to have gone back to the laboratory and recheck the sensitivity test that is appropriate and synergize that dietary adjustment with the appropriate drug. That would have enhanced a higher production that will be higher than what we are seeing on the table here. So now, let's look at my interpretation of this treatment. My interpretation is this: that in Fowl Cholera, with fatty degenerated liver, medication alone may not give a desired result. So if you are a practitioner and you are experiencing this problem with fatty degeneration, and you must not rely on medication alone. Why? Because even the liver is the organ that is going to be responsible for metabolizing the drug as well as the feed that the chicken are taking. And the liver is in a serious problem. So your first choice to rehabilitate the liver. And how do you rehabilitate the liver? By adjusting the energy level and by supplementing the high level of methionine. And this was what we did, and that made us to get the result we presented earlier. Secondly, dietary adjustment, we said, is necessary and methionine level supplementation is necessary. So these two approach is very, very mandatory when you are picking a case of fowl cholera. Next slide. This is the interpretation of what I've just been saying. You can see the first, go back. You can see the first 2 weeks of treatment, the background representation. You can see how the mortality declined gradually. If it is put on a graph, it's going to be a slanting graph, a curve that is sloping down. You can see the sloping down from the 3rd week of dietary adjustment. You can see the mortality started sloping down. Next slide, please. This is the percentage production that was seen. The last production of 13.7%, I told you earlier that if you have synergized with a appropriate medicine on the 4th week, you probably would have gotten a higher percentage of production. But the presentation here is to let us know that we must not rely on drug alone as the solution to the management of fowl cholera. It must be a synergy between the drug and diet. And this slide is talking about the epidemiology and the cycle of occurrences of fowl cholera. It's an interval of 12 weeks. If you see this curve or this slide, look at the peak at 16th week here, and look at the peak on 26th week there. Usually, at 28th week there, you will see a difference of 12 weeks. 12 weeks is the interval of occurrences of fowl cholera. And this is the reason why vaccination is being prescribed by some. Generally, bacterial diseases, bacterial vaccination do not protect more than 3 months. Do not protect more than 3 months. And of course, infection also, after recovery, cannot protect. The immunity cannot last than also 12 weeks. And that is 3 months. So you can use this as a tool for your strategic management. And how do you use that? You assume that in case you have an outbreak around 26, 28 weeks, and if you want to use treatment and you use acceptable treatment, like I've described earlier, don't calculate another 12 weeks. And when it is about the approaching 12 weeks, introduce your strategic management again and your treatment and your laboratory investigation. And you can do that because otherwise it will occur at 12 weeks interval throughout the lifespan of the bird. So this is the issue that we want to emphasize, the issue that there must be a cooperation between your nutritionist and yourself, and the issue that is a cyclical infection, and these are the issues that we want to emphasize that we must practice. Can you see the next slide? I told you in the epidemiology of fowl cholera that some canary birds are involved, especially if you have a poultry farm that has a fish farm also integrated. And if the habit of using the dropping to feed the fish is practiced on the farm, you can see a cyclical occurring of fowl cholera in such a farm. The reason is that the fish farm will attract these canary birds. The canary birds will go to the fish and they will pick some infection or some germs and go back to your poultry farm. And if your nets are torn, they can enter the pen and they can deposit this in the feed, and the chicken can pick them up and they can perpetrate a recurrence of the infection. So these are some of the epidemiological and the predisposing factors that give an outbreak of fowl cholera. But there is one point I want to emphasize, is the point of when you have a long dry spell, like we have just recovered now in Nigeria. It's not been raining for some time here in my location here, and it just started raining now in the last 2 days. As a farmer, you must be aware that there is possibility of an outbreak of fowl cholera coming up in your farm. So what I expect that farmers should do in this situation at this period is to pick samples of their water for laboratory investigation and also put on strategic management or prophylactic management to prevent occurrence of fowl cholera and other bacterial infections that are related to waterborne diseases. I'm going to summarize my conclusion, and I will allow you to ask 1 or 2 questions. One, that fowl cholera is often a chronic disease of poultry. It could linger on through the life cycle of the flock when endemic. It often occurs in a cycle of 12 weeks, starting from the onset, in this case, age 26 to 28 weeks, and then coming up at plus 12, plus 12, plus 12, plus 12 weeks if you do not have a good treatment strategy on ground. That it does a lot of damage to the liver and organ that metabolizes the food and drug, as well as developing follicles that produce the egg. Its effectiveness in treatment must be a synergy of chemotherapy and dietary. So for you to have the best of treatment, must synergize your treatment with your dietary adjustment. I'm emphasizing dietary adjustment because most practitioners will only look on the drug and forget to look at the diet. In the case study we are presented here below, we can see the need for mutual responsibilities of the nutritionist and the veterinarian in the management of some metabolic diseases of poultry, like Fowl Cholera that I've just spoken. Also, in the future, we'll be talking about this kind of joint responsibility in the management of infectious viral disease, Gumboro. I will also be talking in the future about the joint responsibility in the management of malabsorption syndrome in broiler. All this requires a dietary approach to management for you to get a lasting solution. But this Fowl Cholera and the treatment, I think I will ask you to go further and look at the management of nutritional management of diseases in my book, in Poultry Feed Formulation for Trophies by Dr. Spinal. A copy of the book will be displayed, and I think after this we can have one or two questions because of time limit. I hope you can hear me. Thank you.
Thank you, sir. If you have any question, we would like to take like 2 or 3 questions before we wrap up the program. Any question, please? Hello?
Yes, we can hear you, sir.
Is any question?
Hello, sir. Yeah, question, please.
Okay, you are listening.
Okay, thank you very much, sir, for the sharp and very straightforward present. I think I have like 2 or 3 questions. First of all, I would like you to speak more to the pathognomonic sign, especially the ovary stuff. I don't know if you have a picture or something to show based on what you've seen in the field to share with us. And if not, maybe there's a way you can further explain, like you said, because it's not everywhere you have lab you can send to. But again, if you're able to see this sign, you know that, yes, this is what you are dealing with. That's one. Yeah, then 2, for the vaccination thing, you said even if we vaccinate it's likely going to last for just 3 months. So would you think it would be wise to, like, every 3 months, like a preventive thing, vaccination, so that you don't even allow the disease to come in, if that would be very possible? I mean, vaccination, I would say, instead of using treatment, it's whether you've been able to, you can speak on that. Then the last one on the dietary management, a lot of people we consult for, they are more on commercial feed, and it's not something you can really regulate the energy level in those feeds. What would you think if by either reducing the consumption, you can achieve that balance, or let me just throw it, what would you advise? Because most of these guys, they use a commercial feed, and we don't have means to either reduce the energy level or play with the energy level. Thank you very much. Hope I've not taken too much of it.
These are very good questions, and I will fast at answering them. Pathognomonic lesion, I said one specific pathognomonic lesion is the degenerated ovary. And how do they look like? I can't present a picture, but they are very common. You will see the other follicles that are well developed, or you will see a follicle that has been called flabby, that doesn't have the shape of a follicle or blood vessels, but you will see the stalk that hold it. It will be a long stalk that hold it, and then the flabby follicle will be seen on the top. That is very pathognomonic for Fowl Cholera. Then other lesions that you can see, I told you, is the pitication of the liver and the globalization of the liver cells with oil globules forming on surface of the liver. This also. The third one is the petrification of the myocardium. the Mycelium petrification, apart from the peritonitis that you will see. These are enough for you to start suspecting Fowl cholera. Then second question that you ask is the issue of vaccination. Yes, of course. I think that is why the vaccination, I said, the 3 months intervals is what you see usually in vaccination. And it follows, therefore, that if they could be protected in 3 months intervals, why not adopt a 3-month strategic approach in the management of Fowl cholera? I don't have any objection to that.
Problem.
At the same time, if that is not possible, then you must use the strategic approach. Since you know that there is a phase of 12 weeks within the peak of production of mortality and the onset of another one. So you can, by the time we were practicing, the Fowl cholera vaccination arrives early. And if there's no harm in using that to prevent, you can also use this approach of strategic management, of looking at the intervals of the 12 weeks in management. So I don't have any complaint about that. The last one, of course, is that many of the farmers are using commercial feed. Well, I agree with you that specifically for customized feed, you see, there are a lot of integrated farms now that are customizing their feed, you see, and of course, in many countries that we should get to that stage in Nigeria, you have feed for diseased animals, medicated, we call them medicated feed. Medicated feed, and then in which case you will discuss with your feed producer that you want your feed to be medicated for the purpose of the infection that is going on the farm. In that case, your nutritionist or your veterinarian can talk with the producer and they can customize your feed for you. It may be at a premium that will be higher than the commercial one. Thank you very much.
Thank you. Thank you.
Do you have anybody that still have any other questions to ask? Maybe one more question. You probably will have.
Hear me? Please, are you hearing me?
Yes, yes.
We are hearing you. Thank you.
Okay, this is Henry Akinbote.
Okay.
You're welcome, sir.
I want to thank Doctor for the job well done.
Thank you.
Thank you, sir.
For my own book that can throw more light, or that we can have as a work tool for people on the field. You know, this one is good, but at least probably we need a compendium of information, you know, compiled in a book form that at least we can buy. Thank you, sir.
Yes, I concluded my lecture by referring to a book I wrote, and where I discussed about the management of dietary management of seed bugs, and that was my conclusion. So the book is there. And again, I think I want to use this opportunity to address that this NGO is doing this for the industries, and we will appreciate collaboration in the future that can do more. And this kind of thing that the Akibata just said is part of my intention that in future, if we have a strong backing, we could make this book available at a very least cost for farmers. All our interest is to enhance the good will of the industry and to make productivity to be higher. Thank you, Akibata, for that question.
Do you have another one question? We can still take one more question. Do you have anybody that still have any question? One more question.
Okay, hold on. Okay.
Please come again. Hello. Hello. Please, let's hear you. Do you have any questions?
Any other question?
Hello.
Any question?
So,
Hello.
okay. Let's take the last question for the week.
Hello, yeah, hello. Hello.
Yes, good afternoon, sir.
Good afternoon, good afternoon.
Yes, sir. Timothy Ojodari, sir.
Yeah.
I actually want to commend the submission. It's very enlightening, sir. And I realize it's PMR compliant too, using the dietary adjustments to manage fowl cholera. And that's very complimenting. That's what I just want to say. Thank you very much, sir.
Thank you very much. Thank you very much. Thank you.
Yes, sir.
Onakoya, do you have a question for us?
Yes. Yes, I have a question, sir. Can you hear me, sir?
Yes, I can hear you.
Okay. Just as a working tool, sir, by what percentage should we actually reduce the energy of the field?
5%.
Since the
5% initially.
5%.
Yeah, 5% initially.
Oh,
Then you can.
okay.
Yeah, but not too
And
drastic.
we should.
Not drastic reduction. Not drastic reduction.
No, okay, sir. Then we leave the protein as usual, sir.
The protein, you increase the protein and the methionine level.
Okay, sir. Then I want to ask, sir, because there is a indigenous vaccine they make at VOM and this imported one. Which one is actually better? Which one do you recommend, sir?
I want to be as much as possible.
The VOM vaccine.
I want to be as much as possible to be neutral at prescribing any specific drug. I will leave that to the head doctor and your professional to advise. But the general principle is what I'm interested in.
Okay, sir. Thank you so much for your time, sir. We appreciate you, sir.
Thank you. It's my pleasure. It's my pleasure.
Thank you for listening to our first Zoom lecture. I hope we would like to meet you in the next coming week when we have another program. But luckily, before we actually go, we would like to urge every one of us that Lifetime Industry Foundation for Africa is an NGO that's actually working towards the goodwill of the industry. So LEFA is open and appreciate collaboration so that some of these activities we are doing actually. So, and that is something we want us to do. So, if you have any questions for LIFA, or maybe you have any contributions you want to do, or any collaboration that you want to actually do with LIFA, you can get us to our blog on lifa.org, or you meet us on our Facebook. So that is all we have for you today. We wish you all the best.